It's never lupus. At least, according to Dr. Gregory House of the Fox show House MD, it isn't. Except sometimes it is. According to the American Autoimmune-Related Diseases Association, 20%, 1 in 5, or more than 50 million Americans have an autoimmune disease, 75% of which are women. Today, I'm here to talk to you about autoimmune diseases, their causes, types, and the various treatments that are available. First of all, the causes of autoimmune diseases. Fun fact is that they all occur naturally in all people, except 80% of Americans, or people in general, don't have any effect. An autoimmune disease is characterized when your immune system recognizes an organ or another tissue as part of not you. And then your immune system attacks it and you have a problem. The causes of this are largely unknown and misunderstood. Outside effects that can trigger an autoimmune response are bacteria, viruses, toxins, and various drugs. And some people are more prone to autoimmune diseases because they have a genetic predisposition which is passed down typically from the mother's side. Secondly, there are two different types of autoimmune diseases. First is organ-specific, and some organ-specific autoimmune diseases are type 1 diabetes, which is when your body doesn't produce enough insulin, multiple sclerosis, which affects the brain and spinal cord, Graves' disease, which is more commonly known as overactive thyroid, and psoriasis, which is the redness of the skin and thickening and silvery layers on your skin. A person can be affected by several organ-specific autoimmune diseases at the same time. The second type is non-organ specific autoimmune diseases, such as lupus, which is usually noticed when a person has a rash that looks kind of like a butterfly on their face, inflammation, which usually starts in the hands, and complications with the kidney, brain, and heart. Mixed connective tissue disease is also a non-organ specific autoimmune disease, which is also known as an overlap disease because it contains symptoms from various other autoimmune diseases such as lupus, rheumatoid arthritis, and dermatitis. Initial symptoms of mixed connective tissue disease include inflammation in the hands, kidney problems, lungs, heart problems, etc. And finally, rheumatoid arthritis is another common non-organ specific disease, which is characterized by inflammation, heart problems, lung problems, and typically leads to osteoporosis in some people. Common symptoms of many autoimmune diseases are fatigue, joint pain, swelling, headaches, and chest pain. And all autoimmune diseases cause the slow destruction, or not all of these, but some they cause the slow destruction of cells, excessive organ growth, and they prevent some organs from functioning properly. Lastly, treatments that are available for autoimmune diseases. And the first priority is the correction of major deficiencies, such as when your body fails to produce insulin, diabetics take insulin to correct that problem. Something such as thyroid disease, the patient would take hormone supplements to correct that problem, and a lot of diseases cause blood problems, which leads to blood transfusions to replace certain different components of the blood. The second important treatment is the suppression of the immune system, which requires a delicate balance between allowing your immune system to actually work properly and suppressing it enough so that the disease itself doesn't cause as much harm as it would unchecked. Other medications that are taken, or some medications that are taken to help ease the symptoms of autoimmune diseases are NSAIDs, which are non-steroidal anti-inflammatory drugs, such as Advil, ibuprofen, etc. Pain medication is used to lessen, the pain that patients feel if the NSAIDs don't do enough. And immunosuppressants are taken again, to suppress the immune system so that it doesn't cause too many problems. And above all, the standard, take care of yourself, doctor advice of eat right, exercise regularly, get enough rest, decrease your stress, and special treatment is to limit sun exposure and avoid things that trigger an autoimmune response in your body, which is something that you would learn over the course of being diagnosed. And finally, early detection is important for autoimmune diseases, like it is with many others. See a doctor if you have symptoms of symptoms talked about previously. Knowing the causes, educate yourself on the types, and after you see your doctor for treatments. And above all, proper treatment is the key to living with autoimmune diseases.